Plab 2. It was something that I needed to pass and pass well, so that I won't get myself involved in writing another exams, because it's very expensive. Regardless of how many time you have every day, if you don't practice continuously, there is no way you're going to make in this exam. This exams needs your complete attention, needs your complete effort to be able to pass through. It's not easy, but you can make it regardless of what people say. It's all about you putting yourself into it and focusing completely on what you expect and what you must do during the exams. Once you are able to identify that, it's going to be easy for you during the day. You will not feel anxious, you'll be more confident in yourself. So for me, what I did was to join an academy where you have to pay some amount of money, and then you do most of the practice exams. You get materials, you get people to tell you what you're supposed to expect in the exams, because I had no idea as to go according to what I'm going to tell you, because that's the experience I had during my time of the exams. And the same strategy has been used for so many years and it's still in place, so you don't need to change anything. What you have to know is what we call P3 maftosa. So first P is presenting complaints. So we use what we call Socrates or OD para. Now I'll take you through the Socrates. Socrates, first of all, is the site. S stands for the site, O stands for the onset, C for the character of the pain. Is it dull? Is it sharp? Okay. And then I stand for radiation. Does the pain go anywhere else apart from where you spot the pain? Then the A stands for the association. Is it associated in anything at all? Maybe vomiting, certain symptoms that will direct you to a specific diagnosis. So when you ask those association factors, you'll be able to know what exactly your diagnoses are, or your differential diagnoses are. And then you talk about the T. The T stands for the timing. Okay, when the pain comes, how long does it stay? Is it intermittent? Is it continuous? Talk about the exacerbating factor. What do you think makes this pain worse, and what do you think makes this pain better? Okay, these are the things you need to ask. And then the severity of the pain on a scale of 0 to 10. How will you grade this pain? Then you will begin to know how serious the pain is. S for site, O for onset, C for character, R for radiation, A for association factor, T for timing, E for exacerbating, S for severity. Then when you come to cough, then you go and use OD para. O stands for the same as onset, D stands for the duration. How long has this cough been going on? P stands for the progression. Do you think this pain has gotten worse, or it's the same, or it has minimized? You ask the patient, so you need to do this accordingly. And then you talk about the A, anything at all that makes this pain better or worse. And apart from the cough, do you have anything at all that is associated with the cough? And then you ask the patient. Then you ask anything else, that is OD para. So OD para is what you will be asking the patient if the patient is coughing. Okay, so we are done with OD para. So that is P for presenting complaints. Let's talk about the other two P's, and then we do the maftosa. So the other two P's are, one, personal history. People who have had sexually transmitted diseases, you are suspecting that they might have sexually transmitted diseases. You want to know personal history. That is an example of asking for personal history. And when it comes to the past medical history, you also want to find out if this patient has been diagnosed with any medical condition in the past. Then you talk about the maftosa. You ask patient about medication history. Is the patient taking any medication at all, including over-the-counter medications? And we talk about the allergies. Is this patient allergic to any medication or anything else at all that the patient knows they are allergic to? Then you talk about the family history. Is there anyone in the family who has been diagnosed with the cancer, obesity, high blood cholesterol, high blood sugar, or high blood pressure? Then you come to talk about the occupation. People with asbestosis, you want to know what kind of job they've been doing. So you ask about occupation, what they have been doing in the past. And you talk about social history. Okay, Are they smokers? Are they alcoholics? You don't ask them if they're alcoholic. No. So be careful about those questions. You ask patient, do you smoke? Do you drink alcohol? That's what you should ask your patient. And then after you're done with the social history, you then come and talk about anything else patient might be able to tell you. Sometimes patients do not want to express themselves unless you ask them, is there anything else, Mr. John, that you would like to tell me? And then you're done with your P3 maftosa. Please don't forget to go accordingly. So don't forget about your personal history when it comes to sexually transmitted disease, or when it comes to female presenting with bleeding and all this urinary tract infection. You want to find out personal history of this patient. I hope this really helps. So my next video, I will be talking to you with some of the questions that you need to use this P3 maftosa to answer. And I'll guide you through what you're supposed to do. I believe personally that if you follow what I'm telling you today and you are able to join an academy, your confidence level will be so high that you pass the exam so easily. So please don't forget to use this structure in any of the questions you might meet in the exams. You might even not need the academy if you follow what I'm saying, because this is a fact. I've been through it and I took notes of every scenario I met during the exams. So please don't forget to follow your P3 maftosa. And please don't forget to subscribe to my YouTube channel. You'll be the first person to get the video when it's out. And leave any questions at all you think you're worried about, and I'll answer them as soon as possible. See you again. Take care and bye-bye for now.